To explain CAR T cells, I'm first going to talk about some immune cells, a T cell, okay? So your immune system has a type of cell called a lymphocyte, okay? And there are two main types of lymphocytes. One is a B lymphocyte, and the other is a T lymphocyte. The B lymphocyte is what makes antibodies, okay? And actually, patients with diffuse large B-cell lymphoma have a cancer of their B lymphocytes. So that's what diffuse large B-cell lymphoma is. It's a lymphoma of B lymphocytes. But the T cells are usually healthy. The problem is T cells, they're like the conductors of the immune system. They basically secrete chemicals into the bloodstream. We call them chemokines, but chemicals that tell the immune system what to do. So when you're infected with a virus, even like COVID or a bacteria, the T cells help kind of organize the immune response to the infectious agent. Not only do they then help kill the infectious agent, they then help the B cells form a memory to the infectious agent. So when you're re-exposed to this infection, you have a quick, swift removal of the infection and don't feel so bad. It's kind of how vaccines work. And that's usually why when you're exposed to an infection for the second time, it's not as severe because your immune system's learned how to deal with it. And that's all done by the T cells. So we know that T cells in the body can actually recognize cancer cells and kill them, because the cancer cells are a little bit different than the normal cells. The problem is, if you have a diffuse large B-cell lymphoma that's growing, clearly your T cells have not done the job, okay? And that's usually the case for the majority of patients. If the T cells were effective on their own at controlling cancer, we would not develop cancer, but we clearly do develop many cancers. So what we do is we take a patient who's a candidate, and again, these are patients where the frontline therapy didn't work, and where the stem cell transplant also did not work, okay? They also have to, and we'll talk about it when we talk about some of the side effects, they have to be, in reasonable, what we call performance status. It is an aggressive therapy. So for patients that, can't get out of the house or are confined to their bed, it is not appropriate therapy. It wouldn't be safe. So what we do is we collect the cells, just kind of like we did for the stem cells, but this time we filter out the T cells. So now we have a collection of T cells from the patients. So these are the patient's own cells. We then take the cells and we send them to the lab. And the lab could be either on clinical trial or for the FDA approved products, which there are now 3 CAR Ts approved for diffuse large B-cell lymphoma. We send them to the company, okay? And the company will then genetically modify the T cells. What they do is they engineer the T cells. So now that the receptor on the surface of the T cell recognizes the lymphoma. And on diffuse large B-cell lymphoma, there is a target. It's called CD19. You don't need to remember that. Just think of it as a little spot on the cell surface of a diffuse large B-cell lymphoma. It is expressed by all diffuse large B-cell lymphomas. And what we do is we engineer the T cells from the patient to be specific for CD19. So that takes about 2 to 3 weeks from collecting the cells to the manufacturing of the product. And then they ship the product back to the hospital, or in our case, so our cancer center, where we administer the therapy. And what we do is we usually admit the patients to the hospital, although there are now programs where they're doing this outpatient. But for the sake of this talk, we'll talk about outpatient administration. We admit the patient to the hospital and they get 3 days of chemotherapy. Not a lot of chemotherapy, just a little bit of chemotherapy. And it's not meant to kill the lymphoma. It's meant to get rid of some of the patient's immune cells to make them more receptive to the modified T cells, okay? And then we get 3 days of chemotherapy. Then there's a day of rest. And then there's the cell day infusion where we administer the CAR T cell. And now remember, these have been modified to be specific towards the cancer cell. The administration is just like a blood transfusion. It's a bag of these T cells, okay? And then the T cells infuse into the patient. And this is where the side effects can happen.